HIV, human immunodeficiency virus, human immune deficiency virus, is a virus that can be transmitted through blood and unprotected sexual contact and can settle in various tissues of the body, primarily affecting the immune system. HIV primarily suppresses the immune system by destroying white blood cells called CD4+T lymphocytes, commonly known as CD4 cells, and leaving the body vulnerable to infections. As a result, diseases that can normally be treated, such as tuberculosis, diarrhea, meningitis, pneumonia, can cause serious harm to the body, and in some cases, cancers can occur. Today, medications developed for HIV prevent the virus from replicating in the body and suppressing the immune system, allowing HIV-positive individuals to live long and healthy lives. Early initiation of treatment and regular follow-up under the supervision of a doctor are important for this. What is AIDS? AIDS, acquired immune deficiency syndrome, is the stage when the immune system is vulnerable to infections and cancers due to the HIV virus. Contrary to popular belief, not everyone who is HIV positive develops AIDS. Antiretroviral drugs developed against the HIV virus allow the immune system to fight infections without serious damage, meaning that body resistance does not decrease. After HIV infection, in addition to drug therapy, AIDS may not develop depending on the person's living conditions and body resistance, or it may develop 5-15 years or later. Frequency of HIV in the world and in Turkey, HIV is a widespread infectious infection worldwide. According to the World Health Organization, 37 million people worldwide are carriers of the HIV virus. 60% of HIV-positive individuals are receiving antiretroviral treatment. In our country, with the increase in awareness and testing opportunities about HIV, an increase in the number of diagnosed individuals is observed. However, Turkey is considered among the countries where AIDS is not common. According to the research conducted by the Ministry of Health, between 1985-2018, the number of HIV carriers in Turkey is 18,557 people, and there are 1,636 AIDS cases. The age groups with the highest number of cases are 30-34 and 25-29 age groups. When looking at the distribution by transmission route, it is observed that 49.6% of the cases are transmitted sexually, and among these cases reported to be sexually transmitted, 71% of the transmission route is heterosexual intercourse. In 2018, the number of people diagnosed with HIV is 2,199, and 83% of these individuals are male. Those aged 25-29 are more than other age groups. An increase in the trend of HIV incidence is observed over the years. Importance of early diagnosis. As in many diseases, early diagnosis and accordingly early treatment are important in the treatment and course of HIV infection. Early diagnosis not only extends life expectancy, but also reduces transmission rates. Those who engage in unprotected sexual intercourse, those who may come into contact with HIV-positive blood during sexual contact or contact with open skin, those who use non-sterile needles, piercing tools, must undergo an HIV test. For the test to give accurate results, antibodies need to be formed in the blood, so the HIV test gives the most accurate results 4 to 6 weeks after contact with the virus. In our country, HIV testing is done while fully preserving the person's privacy. The information regarding patients applying to healthcare institutions due to HIV/AIDS, their treatments and tests, is reported by coding their identities. If a person is HIV positive, it is mandatory to report to the Ministry of Health, but it is done while following the rules mentioned above. Psychosocial support is important for HIV-positive individuals and their families during their treatment. There are many associations in our country that provide social and legal support for HIV-positive individuals and their families. HIV testing is among the mandatory tests before marriage, but being HIV positive is not an obstacle to marriage. Transmission routes. HIV is transmitted from person to person. The virus is found in the blood, semen, vaginal secretions, and breast milk of HIV-positive individuals. It can be transmitted from both men and women. The transmission routes of HIV are as follows. Sexual contact. 80 to 85% of HIV infections worldwide are transmitted through unprotected sexual intercourse. The virus is transmitted through contact of blood, semen, or vaginal fluid with the mucous membranes of the penis, vagina, anus, or through cuts and cracks on the skin, cuts and cracks. The virus can be transmitted from male to female, female to male, male to male, female to female through sexual intercourse. HIV can be transmitted through vaginal, oral, and anal sexual intercourse. One unprotected sexual intercourse with an HIV-positive person is enough for transmission. As the number of unprotected sexual intercourses increases, the risk of transmission also increases. Blood products. HIV is more abundant in blood. The virus can be transmitted through blood and blood products taken from HIV-positive individuals. Possible situations include contact of HIV-positive person's blood with another person's blood, transfusion of untested blood, transfer of HIV-carrying organ, tissue, and sperm, using used and non-disinfected syringes, needles, surgical instruments, dental instruments, cutting and piercing tools, razors, scissors, tattoo tools, and acupuncture needles, intravenous, entry of a syringe infected with the virus into a vein, intravenous drug use with a common syringe, etc. Bleeding from the sexual organs of HIV-positive men and women may also cause transmission. Since 1985 worldwide and since 1987 in Turkey, all blood and blood products have been screened for HIV. Blood donors are also tested, therefore transmission through blood is very rare. Transmission from mother to baby. During pregnancy, an HIV carrier mother can transmit the virus to the baby during pregnancy, childbirth, and postpartum. During breastfeeding, this virus can be transmitted from the mother to the baby at a rate of approximately 20–30%. It is important to have a cesarean section for delivery and for the mother not to breastfeed after delivery. HIV-positive treatment starts in the last 3 months of pregnancy for the mother and after birth for the baby. Since transmission from mother to baby, horizontal transmission, occurs at a rate of 35%, it is very important to take precautions. HIV does not spread in these cases. Being in the same social environment, room, school, workplace, breathing the same air, sneezing, coughing, saliva, tears, sweat, urine, feces, and other bodily fluids, handshaking, social kissing, holding hands, hugging, touching the skin, caressing, cuddling, kissing, blood contact with intact skin, eating from the same plate, drinking from the same glass, using shared fork, spoon, glass, plate, phone, using the same toilet, shower, and faucet, swimming in the same pool, sea, sauna, hammam, and using common areas such as shared towels, mosquito and similar insect bites, animal bites, living with animals such as cats, dogs, misconceptions and prejudices about HIV in the past made life difficult for HIV-positive individuals, hindering their participation in social and work life, but today, awareness-raising efforts on HIV have reduced these prejudices.